It is dinner time. Your dog finishes their bowl in under 30 seconds, the way they always do. But then, 10 minutes later, you notice something off. They're pacing, they're restless. Their belly looks slightly swollen, and they try to vomit, but nothing comes out. They just keep retching over and over with absolutely nothing coming up. If you have ever seen this happen, I need you to listen to every single word of this video because what I'm about to explain could save your dog's life one day. This single combination of symptoms, a swollen belly, and unproductive retching right after eating, is one of the few true life or death emergencies in veterinary medicine. And most pet parents have no idea it's happening until it's almost too late. Hi everyone, I'm Dr. Alex Martin, your neighborhood veterinarian. In my career, I have seen dogs come into the clinic completely fine 1 hour and in critical surgery the next, all because of what happens after a normal meal. Today, I'm going to teach you exactly what this condition is, why it happens, the warning signs you cannot afford to miss, and exactly what to do in the first 5 minutes if you ever see it. This is not a kitchen remedy video. This is the one video that could save your dog's life. Please hit subscribe because this information matters more than almost anything else I teach on this channel. Let's talk about what's actually happening inside your dog's body. The condition is called bloat, and the medical term is Gastric Dilatation-Volvulus, or GDV. Here's the simple version. After your dog eats a large meal, especially if they eat fast or gulp a lot of air while eating, the stomach can fill up with food, fluid, and gas. In most dogs, this is uncomfortable but harmless. The stomach settles and everything moves through normally. But in certain dogs, especially large, deep-chested breeds like Great Danes, German Shepherds, Standard Poodles, and Labradors, something far more dangerous can happen. The bloated stomach is so full and so heavy that it actually twists on itself like wringing out a wet towel. This is the volvulus part. Once the stomach twists, both the entrance and the exit get sealed shut. Nothing can go in, nothing can come out, not even gas. The stomach keeps expanding because trapped gas has nowhere to escape. And here's the part that makes this a true emergency. As the stomach swells, it cuts off blood flow to itself and to nearby organs, including the spleen. Without blood flow, that tissue starts to die within hours. The dog goes into shock. Without emergency surgery, this condition is fatal in most cases, often within hours of the twist occurring. This is why I need you to know the warning signs cold, because acting in the first 30 to 60 minutes is what separates a dog who survives from one who doesn't. Sign number 1, a swollen, hard, or distended belly, especially right behind the ribs. It can look like the dog swallowed a basketball. Sign number 2, unproductive retching. This is the big one. The dog is clearly trying to throw up, heaving and gagging, but little or nothing comes out. This is different from normal vomiting, where food or liquid actually comes up. Sign number 3, restlessness and pacing that won't stop. The dog cannot get comfortable, cannot lie down, and seems anxious or distressed. Sign number 4, excessive drooling. Sign number 5, a rapid heart rate, pale gums, or visible weakness as the dog goes into shock. Real-world example. A few years ago, a family brought in their 7-year-old Great Dane named Murphy. He had eaten his normal dinner, then gone outside to play fetch right after, something the family did every single night without ever thinking twice about it. Within 20 minutes, Murphy started pacing in circles. His stomach looked tight and swollen, and he tried to vomit, but nothing came up. The owner thankfully recognized it immediately because a friend had lost a dog to bloat the year before. They rushed him in. We got him into emergency surgery within the hour. His stomach had already begun to twist, but because they acted so fast, we were able to save him. I tell you this story because the family who waited even 1 more hour might have told me a very different ending. So if you see these signs, here is exactly what to do, step by step, right now. Step 1, do not wait to see if it gets better. Bloat does not resolve on its own, and it does not slow down. Every minute matters. Step 2, do not give your dog water, food, or any home remedy. You cannot fix this with anything in your kitchen. There is no oil, no vinegar, no supplement that reverses a twisted stomach. I know that goes against everything else I teach on this channel, but this is the one condition where natural remedies have zero role. This requires emergency veterinary intervention, full stop. Step 3. Call your emergency vet or animal ER immediately, on your way out the door, not after you arrive. Tell them you suspect bloat or GDV so they can prepare for you before you even walk in. Step 4. Transport your dog calmly but quickly. Don't let them jump or run, since added pressure on the stomach can worsen the twist. Carry smaller dogs if you can, and keep larger dogs calm and walking gently to the car. Step 5. Once at the vet, they will likely take an X-ray to confirm whether the stomach has twisted. If it has, your dog will need emergency surgery to untwist the stomach and, in many cases, a procedure called a gastropexy, where the stomach is surgically tacked to the body wall so it cannot twist again in the future. Now let's talk about prevention, because this is the part you actually have control over every single day. First, slow down fast eaters. If your dog inhales their food in under a minute, get a slow feeder bowl with ridges and grooves built in. This single change dramatically reduces the amount of air a dog swallows while eating. Second, split meals into smaller portions. Instead of one large meal a day, feed 2 or 3 smaller meals. A smaller volume of food puts far less strain on the stomach. Third, restrict heavy exercise right after meals. This is the mistake that happened with Murphy. Wait at least 1 hour after a meal before allowing vigorous play, running, or jumping. Fourth, know your risk factors. If you have a large or giant breed dog with a deep chest, talk to your vet about a preventive gastropexy, sometimes done at the same time as a spay or neuter. This is a proactive surgery that essentially makes future bloat impossible by tacking the stomach in place before anything ever goes wrong. Fifth, elevate feeding only if your vet recommends it for your specific dog. There used to be a popular belief that raised feeding bowls prevent bloat. Recent research has actually been mixed, and some studies suggest elevated bowls may increase risk in certain breeds. So please don't assume a raised bowl is automatically safer. Talk to your vet about what's right for your dog's body and breed. I know this video felt heavier than my usual kitchen remedy content, and that's intentional. This is the one condition where I will never tell you to try something at home first. Bloat moves fast, and dogs who survive are almost always the ones whose owners recognized the signs early and got to the vet immediately. Let's review the battle plan. Sign to watch for: a swollen belly paired with unproductive retching. What to do? Do not wait. Do not feed or give water, call ahead, and get to the vet immediately. What to do going forward? Slow feeders, smaller meals, no vigorous exercise right after eating, and a conversation with your vet about your dog's individual risk. If this video taught you something you didn't know, please share it with another dog owner, especially if they have a large or deep-chested breed. This is exactly the kind of video that could help someone recognize the signs in time. Hit that like button, hit subscribe, and let me know in the comments, did you know about bloat before this video? Or has your dog ever experienced something like this? I read every comment, and I want to know your story. I'm Dr. Alex Martin. Take care of your best friend, trust your instincts, and I'll see you in the next video.